1 minute, sir. Just stand by for 30 seconds. Waiting for Dr. Ruby to switch on her video.
We are live, sir.
Okay. Good morning, everybody. Good morning, Bala.
Dr. Ruby, you can switch on your audio and video, please.
Yeah, now you're okay, Ravi. Ravi Mani, good.
So you're good to go as soon as she comes in, sir.
Yeah.
I can just call her and let her.
No, she's there. She has to just switch on her.
She's here.
You can unmute yourself and then come on video, Ruby. We're all ready.
Yes.
It's coming online, sir.
Yeah. Come here. Yeah. There.
Yeah, she's on mic.
Yeah. Morning, Dr. Ruby. Welcome to the AFUA eConnects series. We have hit many goals during the eConnect series that we have been having for the last 18 months. And most of the time, we call up somebody and that lady or gentleman agrees to speak to us promptly, of course. But today, Dr. Ruby Pawankar, she volunteered to talk to us. And then I got on to reading about the blazing trail Dr. Ruby has set for, Indians to be mighty proud. The most important thing is she's done a graduation in AFMC, and thereafter set about a blazing trail all over the globe. And there is no organization in the World Allergy in which Dr. Ruby is not a member. Ma'am, you have made us very, very proud. Welcome to the eConnect series of the AFUA. I hand over to our secretary, Wing Commander Harshavardhan, who will introduce you. Thank you, ma'am.
Dr. Ruby, kindly unmute yourself.
Okay. Thank you very much.
Good morning, ladies and gentlemen. Welcome to this Sunday morning episode of our eConnect series. Like our president said, this would be the last one that would be being hosted by this present committee. And special good morning and welcome to Dr. Ruby Pawankar. Thank you, ma'am. Thank you for having volunteered to speak to us. We are very happy that, you liked some of our programs and then you really wish to share your knowledge with us. Thank you very much. Well, ladies and gentlemen, before I hand over the proceedings to Dr. Ruby, I wish to give a small introduction like I do for all our other speakers. Professor Dr. Ruby Pawankar, MD, PhD, FRCP from UK, and FAAAAI. She is the president of the Asia Pacific Association of Allergy, Asthma, and Clinical Immunology, abbreviated as APAAACI. She is the past president of the World Allergy Organization in the years 2012 and 2013. Incidentally, she was the first woman president since the establishment of WAO in 1951. Dr. Ruby is also board member of the Collegium International Allergologum. She is presently the professor of allergy, Department of Pediatrics at Nippon Medical School, Tokyo, and guest professor at Showa University School of Medicine. Professor Pawankar is a member of several academic organizations and serves on the committees, including the Japanese Society of Allergology, American Academy of Allergy, Asthma, and Immunology, European Academy of Allergy and Clinical Immunology, Royal College of Physicians, UK, World Universities Network, and WHO GARD. She has received several awards, to name a few: International Distinguished Fellow Award from the APAAAI, World Allergy Organization's Gold Medal Award for her contributions to WAO and allergy globally, and is also the recipient of the Pravasi Bharatiya Samman Award from the President of India in 2010. Her research interest in allergy and asthma on the mechanisms, clinical implications, and epigenetics, as well as air pollution, has led to over 562 publications with an H index of 77 and 38,613 citations. That's a great achievement. As a global leader in her field, she has lectured widely in over 50 countries and at premium institutes. Her efforts have focused on addressing allergic diseases as an important NCD public health issue via education, training, and leadership development through mentoring and advocacy with health ministries and patient organizations across the countries and global health bodies, including the United Nations and the World Health Organization. In her role as President WAO and currently President of the APAACI, she has initiated several new initiatives and currently is active with our COVID-19 task force in addressing the facts and myths on COVID-19, managing patients with allergies in the pandemic, and creating guidelines and guidance on COVID-19 for the Asia Pacific region for HCWs and the public, addressing the safe implementation of vaccines. Well, ladies and gentlemen, that's Dr. Ruby Pawankar for you. And ma'am, it's now right over to you. And once you finish with your talk, we will take over the question and answer sessions. It's over to you, ma'am. Thank you. Welcome once again.
Thank you very much, Wing Commander Harshvardhanji, for your kind introduction. That was really long. I expected you to give a very short introduction of me. And I'm actually deeply grateful to this august organization for inviting me to speak in this meeting. And I had heard about it, but when I heard about your initiative in doing these kind of very professional lectures during this COVID times, I was quite excited and really happy to have the chance to speak to this august audience. And first of all, I'd like to congratulate all of you for your 27th anniversary, which you just celebrated on the 7th of August. And that is wonderful. So I am honored that I'm speaking on a day after the celebration of your 27th anniversary. I also extend my warmest greetings to Lieutenant General Sundar Rao, who is the patron of this organization, and to the President, Air Marshal S. Vardhaman, who is the current president. And I also appreciate and give my warmest regards to all the office bearers and members of this august organization. Coming from AFMC, from the Armed Forces Medical College, and also with a little bit of touch with the Army, because my uncle, my mother's eldest brother, was the Judge Advocate General of India. My affiliation with the Army and my love for the armed forces, I would say, all three, is deep-rooted in my heart and has great respect. And I would like to also appreciate all the great work that was done by members of your association. For example, the fact that the president of your association is actually a very renowned test pilot. The fact that the First Lady is actively involved in an area that's close to my heart, that is working for Doctors Without Borders. I would love to do that. That's something I would, I really admire. And that the brave son of India, Wing Commander Abhinandan Vardhaman, shot down an enemy aircraft and saved our country. So in short, I would like to say that my respects to all of you for helping us live this peaceful life, to be able to conduct our careers and to pursue our vision and our passion, which we would not be able to do had we not been in the safe hands of all of you. So I start my lecture by giving my deepest respects to all the veterans and all of you who have worked so hard, put your own lives at the risk for the safety of all of us. So with that, I will start my talk.
Yes, ma'am.
And I'd like to just, my talk is basically more conversational in a way. I'll just put in some pictures just to make some relevance to certain incidences. And I would like to have a lot of opportunity for us to interact, so I could learn from you also about your experiences, as well as take questions regarding my own.
Sure, ma'am. You, until finish, we have opened the question and answer sessions, and there'll be a lot of interaction with you from our members.
Okay. Okay, I will open up my presentation and screen share. Yeah. So the talk today is basically about leadership in medicine and science in a changing environment. We know that from the time that we were students to now, things have changed all over globally. And also there is a lot of diversity in the situation between countries, in the way we learn, the way we teach, the professional attitude towards gender, the professional attitudes towards success. Again, success is not measured by something that is materialistic, but more about what change you can make. And that's, for me, that's my vision. I always believe that success is measured by the difference you can make in the lives of others, be it patients, be it students, be it the people of a country, be it colleagues, be it anyone. So my origins, actually, I'm from Kerala. I'm a Malayali, so I'm quite close to you, and I probably can understand a little bit of Tamil because of the similarity between like Tanni Venam, kind of. And my aunt was the mayor of Madras, Tara Cherian, and my uncle, Dr. P.B. Cherian, was also with Madras, Dean of Madras Medical College. So I have roots also in Chennai. But I was, although I come from Kerala, I was born and brought up in Calcutta because my father headed a firm in Calcutta. And I come from a family which, the Manorama family and Palathinkal, and I studied in this school here, and we are just two of us, my brother and me. So we lived in Calcutta as four of us. My mother used to teach in school, but she gave up her job for bringing us up. And my brother, of course, is much elder than me. He passed away last year, unfortunately, not with COVID, but with a pulmonary embolism post surgery. But basically, he was one of the early graduates from IIM Calcutta and a topper from Calcutta University. So I studied in Loreto, and I loved actually studying in Loreto because Loreto had a very, very good system of trying to have a holistic way of developing your students' career as a student. So we were encouraged to do our studies in the subjects that we had to study, but we were also encouraged to debate, to do elocution, to be in drama. And so I was very much active in debates, in drama, in reciting soliloquies from Shakespeare. I did that when I was in the 2nd grade. And of Hamlet, I recited Hamlet at that age. And of course, games, I was mainly into table tennis. So it was a very holistic way of education that I received from Loreto. But then in high school, when my dad retired, I moved to Kerala. And then I did my 9th and 10th and my pre-med from Kerala, from Kottayam. And that was also a little bit of a cultural change, that even though I belonged to Kerala, I was born and brought up in Calcutta. So there were cultural differences which I had to adjust to. But of course, that was also something I took on and tried to do my very best. But one of the things I would really like to highlight here in my early life is some things my parents actually inculcated in us. And I think education is in school, but the actual education happens at home. And that's where your values are inculcated in you. So I remember my parents telling us, because we being in Calcutta, we never met all our relatives. So we would know them by name sometimes, but we never had met them. Sometimes we would meet them on our holidays, but we couldn't meet everybody because people were scattered in different places. So my father always told me that, okay, Dr. Mary Punnan Lucas is your great-grand aunt, and she was first lady surgeon, and so and like that. So you have many firsts in your family, but you are just privileged to be born into this family. You do not have an onus to it. So you have to set your own life. You have to make your own space to be considered to be deserving enough to fit into this family. So he inculcated in us the important value of respecting everyone, being it a poor person, being it a servant, being it a senior, being it a colleague. And at the same time, he inculcated the values, and so did my mother, that we had to be self-made. This was very much a strong principle that I remember learning from my childhood, that it's important to have family pride, but that should not come in the way of your own character, that you should not be boastful about that, and that you need to do your own job and you need to work hard, you need to strive, and that there is no compromise to excellence and perseverance, and do it the right way, go the right way, go the right path. So these values inculcated into us as children, I still remember, did not make sense at that time really, but made a lot of sense as I grew up, and even more as I started establishing myself. From there, I moved on to, after my pre-med, I was very privileged to be in Armed Forces Medical College. I was so thrilled to get admission there. Now, my life to be a doctor was, I always wanted to be a doctor as a child. Even as a child, I used to feel very passionate about people who were sick. And I was really driven to try to help people who were sick. So when I first told my dad and my mom that I want to be a doctor, my dad thought I was joking. He said, it's a very tough life. You'll have a tough time, no sleep, no this thing. It's going to be very tough for you. You should become a diplomat. And he encouraged me to sit for the IFS exam. and wanted me to go to become in that trail of diplomats. And of course, I have both doctors and diplomats in my family, and he tried to tell me to go in that route. But I was very insistent on doing medicine. So when I got admission into AFMC, I was so thrilled. I was really thrilled. AFMC gave me a lot of exposure. I grew up in AFMC, gave me friends that today also remain my friends and are like a family to me. One of the major things that did happen in AFMC is it was for the very first time that I had stayed away from family. I had never stayed away from my parents. So I was really, really lost without having my parents. So all my activities like drama and debates and elocution, I was completely silenced there because I was suddenly in a world that I was not familiar with, a new world that I had to still grasp and get used to. And at that time, I would like to say one of my first roommate is the wife of Wing Commander Ravi Shankar, Indu Subramaniam. And she was my roommate. She took good care of me. And her parents, Colonel Subramaniam and his wife, were like my parents to me in Pune. So we used to visit their home on weekends and have lovely food there. And besides him, I mean, Colonel Subramaniam being a fantastic teacher and a wonderful person, but I found a set of parents away from home in Pune in those parents. And, you know, we were very close to sisters and her parents too. So that was really one thing I remember. And of course, I would say that AFMC taught us a lot. But besides all the medicine that we learned from there, and we had fantastic teachers like Colonel Subramaniam, like Dr. Mysorkar, Dr. Zergar, so many, Dr. Karnani, many, Dr. Pradhan, many excellent teachers over there. But also it taught me a lot about life. I grew up there. Means it was literally like a child growing up to become an adult and learning a lot from my friends, from my colleagues, from my teachers. And I owe a lot to all my batchmates for being there for me at that time and for being there for me even now. So I dedicate a lot to them. And I come from the O batch, so I really dedicate a lot of my life to the support and love and care that I have received from them during my college days and even now throughout. And after graduating from AFMC, I did my post-graduation from BJ. And that's when I met my husband. So I'm originally Matthew by surname, but I married Umesh Pawankar, who actually was a museologist. So he trained in managing museums from MS University, Baroda. And he had joined the Raja Kelkar Museum as that time the senior curator, and that's when we met and we got married. And it was through him that I first came to Japan because he was invited by the Japanese government to give, to basically curate an exhibition for Festival of India. My interest was in allergy. And why? Because when I was practicing in India in those days, we would see patients with allergies, but we had absolutely no clue how to treat patients with allergies. The only thing I remember, Dr. Bapat used to be there who would do some kind of skin testing, but beyond that, there was nothing in those days. This was the early, the 1980s and 1986, 87. So really, so that led me to the desire that I must do something in allergy. And I was very keen to go to US to do allergy and to Johns Hopkins in particular, because my husband had trained at Smithsonian. But over time, because of this, when I came to Japan with my husband, I was actually invited to come and study here. And I realized that Japan has a lot to offer. And it brought me to the thoughts of the writings between Tenshin Okakura and Rabindranath Tagore. When Rabindranath Tagore said, why don't we Indians look towards East? Why do we always look towards the West? And that's really true that it happened in my life. So I moved to Japan. And when I moved to Japan, I planned to be here just 6 months and then move to the US. But then I met some of the real great leaders. Besides my clinical mentor, Dr. Okuda, who actually did my clinical training for me, some of the scientists who really influenced my life are in this picture. So the Professor Tomio Tada was a great man, not only as a scientist, but also he was a cultural person. He actually wrote No plays. No was one of the most highest level of performance, even above kabuki, a dance performance, actually, we would say in a common language, but it's a theatrical performance, and that he used to write No plays. He was also the president of the International Immunology Society, but more importantly, he discovered the suppressor T cell, which today is known in the form of T regulatory cell. So he was very much influential in my learning the immunology aspects of allergy and immunology. And he passed away, of course, some years back. And Ko Okumura, again, a very well-known immunologist, and his team, Chisei Ra and colleagues, they trained me also. And then this on the right side is Professor Ishizaka. I never trained with him, but Professor Ishizaka trained Professor Tomio Tada. And Professor Ishizaka discovered the immunoglobulin IgE, along with Professor Johansson and his wife, Teruko. And IgE is the basis of many diseases, but even more so of allergy. There is type 1 allergy is basically because of increased IgE. So he was a discoverer of that. And in fact, a Nobel Prize candidate, but because there were 4 discoverers together, Nobel Prize can be given only to 3 maximum. So that was why they never received the Nobel Prize. So these people were very influential. And what I'd like to say out here is mentorship is very important. Having the right mentors is so crucial. My future was shaped by these people. My knowledge and my direction, my passion, my curiosity, the way I actually look at science, the way I relate science to medicine, and how I try to look at the translational aspect, how a particular science can be related to the patient and brought back to the benefit of patient care, came from these people who actually guided and mentored me. So mentorship and leadership is very important. And being able to get the right mentors in your life is a big fortune, I would say. And I was very, very lucky in being able to be mentored by them. Then comes the role of, after being mentored, what is your role as having been mentored? Being mentored also teaches you to mentor people. And to mentor people in science, mentor people in medicine, and mentor people so that they become leaders for the futures. Because if we are just where we are and it's all about us, then there is no future. We have to build the future. Building the future is part of leadership. And so this Japanese lady, she has trained with me. This is a Chinese professor who had trained with me. These are Japanese girls who have trained with me. They are all done their doctorate and they're doing extremely well. And this on the right side are not people who are directly trained with me, but those who were under Professor Chesmi Akdis and me during our presidencies. These were the junior members. So we started in our own respective organizations, something called Junior Members Group or Junior Members Association, basically with the same kind of vision that we have to bring up the younger generation, and both men and women with gender parity, give them a platform, give them all the support so they can lead one day. And I can proudly say that, let me go back. Oh, sorry. And I can proudly say that in this lot, this was in 2013, this gentleman here, Enrico Heffler, is now a full professor in a university in Italy and leading a big group himself. Stefano, as she Sylvia is also a leader. Stefano Arasi is also a leader. So many of them that were this is just, I would say 2013. So that's about 8 years back. 8 years back, these junior members, today, many of them have become leaders in their own capacity. And these two also, and these are also. And this clearly shows how important mentoring is. So to be mentored also teaches us to mentor. To get also teaches us to give. And by building this future generation, you have expanded the number of people you can reach, the number of patients who can be benefited, and the level of science that can increase. Along with that is also scientific meetings. Now, scientific meetings are not just created because you want to be the chair of a meeting or a president of a meeting. They always have a mission. This meeting was the first meeting we held in Japan on the concept that allergic rhinitis and asthma are closely related. And I remember in 2002, this was a year after my husband passed away. Unfortunately, he passed away in 2001 because he was here as a professor of international cultural relations. But due to an aneurysm that ruptured very suddenly, he passed away in 2001. And this was in the beginning of 2001 that we had this conference. He was very much there. So you can see him somewhere in this picture. He's standing behind somewhere. Here he is, because he's not a medical doctor. So he just stood there as my husband right behind. And these are all, this is Tomio Tada, my mentor. And you can see all these different people from around the world, almost 30 different countries as faculty in Japan for a conference. And this was a time we had, along with WHO, just created the new guideline called allergic rhinitis and its impact on asthma. Before that, nobody knew that asthma and allergic rhinitis were really connected. And so we created guidelines to show how important the two are and how important to control asthma, you should also control allergic rhinitis and vice versa. Now it's like it's a common thing everybody knows. It's like a household term, that ARIA or allergic rhinitis and asthma. But at that time, so this was the very first meeting that was held, and this is me here. And this is the very first meeting that was held in Japan, in Tokyo, on this particular topic of allergic rhinitis and asthma. And when I first spoke about this in my lecture series in India, in Chennai, that session was chaired by Professor Thiruvengadam, that you may all know because he just has received the Padma Bhushan posthumously. And he actually was a very great scientist and clinician himself. So he had chaired that session when I had lectured in Chennai in 2002. So the scientific meeting was held with a particular purpose of trying to increase the awareness that asthma and allergic rhinitis are interrelated. Then in 2004, I wanted to do something in India beyond just lecturing. So I said, let's have a conference. So we organized the TransPacific Allergy and Immunology Conference in India, in Mumbai, in 2004, with about 1,400 delegates and almost 85 international speakers and about 65 to 70 Indian speakers. It was held at the Oberoi in Mumbai. And this, as you can see, was His Excellency, Dr. Abdul Kalam. He had inaugurated the conference. I was greatly honored by him that when I went to invite him to please come and inaugurate, we were not sure whether we would be able to have him because it's not even in Delhi. So if he has some urgent political commitment, he cannot come. But we were very lucky to have him. This is Ramesh Dekka from All India Institute. That time he was the director of the All India Institute. And of course, you can see here, this is the governor of Maharashtra at that time. So he was inaugurating this. And so this actually was a turning point for people to get interested in the field of allergy in India. So after that, many people have started moving into trying to learn more about allergy, but still I think a lot needs to be done in India in this specialty, unlike other specialties that are really, really well advanced and robust. On the right-hand side, I can just say that I was I'm deeply humbled that in 2010, I received the Pravasi Bharatiya Samman Award from President Pratibha Patil. And it was really a big surprise to me, because I did not ever imagine that, it is, like I said, it's, getting an award or getting a position is not important. What is important is to follow your own vision, your passion, and the results of that particular vision or passion is more important than the recognition. The recognition is okay, it makes you happy for a day or two, and that's it. Beyond that, it doesn't really matter. But I was deeply humbled that the country chose to recognize me for my role in globally and for becoming the first woman president in 62 years since the foundation of our organization. And still, as of yet, I am just the only woman president of this organization, and I hope to see a second woman president. Now, this was the Congress, again, we held. So as president, we are allocated to organize conferences. So this was my co-president. He was the president of the European Academy, and this is me. You may not recognize me, but this is where what I was when I was really very busy. I'm still busy, but I had really over time with my work schedule, the time, the travel, everything, I had put on a lot. I'd like doubled my weight, and that this is me actually. So this is our inaugurating, and at this occasion, we had 8,500 people attending our conference, and this is Andrea Bocelli performing, and he did it without we didn't pay him anything. It was just a voluntary thing because of the generosity of some of our doctors who treated his family. So, and this meeting again was not because of just having a meeting. There was a lot of good science. There was a lot of good education that happened in this meeting. And it's still remembered as one of the top conferences of the World Allergy Organization and the European Academy. At this point, again, and this is where I again say that the veterans and the seniors are very important. And this is not part of what we do always. This was not a regular system. But I felt it's very, very important to recognize all my past presidents, because they laid the foundation to what I was doing. And to become the president was not the most important thing for me. I think it was an honor for me. I was humbled by it, but it came with a challenge. It came with a challenge because I was the youngest president. I was the first woman. And for me, I felt I don't have to answer to someone else, but I need to answer to myself. At the end of my presidency, what have I done differently, and what added value have I brought to the organization that I am president of? And if I cannot answer that to myself, then I should never have been the president of this organization. And I think that particular thing was one of my driving factors. So this, of course, is a picture recognizing all the past presidents. But when I became president, and this is what I would like to just highlight here about leadership, that leadership for me is not a position of power, is a position of action. A leader leading by example and creating initiatives, just like this organization of yours. Even in this particular COVID times, you have chosen to use this as a very nice time to bring in people and have good lectures by people you think are appropriate and eminent and people who would add value. So you utilize that time so beautifully to have these series of lectures. So that is a great vision. So what I did is I learned a lot. I tried to learn a lot. I realized that leadership is not how much of allergy I know or how many papers I've published. Leadership is beyond that. So I tried to learn what it takes to be a good leader. How can I motivate my team? How can I create a strategy? What is the meaning of goal congruency? How does what I do continue into the next system? Because the organization and is always bigger than oneself. And I am there for a certain number of years. If after that, the things don't go further, then I have done disservice to the organization that I am leading. So this actually was a great, great thought process that I would say with God's grace, I was blessed with. And so I created a strategy that I shared with all these people and asked them, this is my strategy. Please critique it. Please scratch out anything that's not important. And please add what you think would be important. So the final strategy that came was a result of collective thought. And then we had a board of 20 people, which I will show you in the next slides that come up somewhere. I think it is there. I may have not organized it in the right way, but I had a board of 20 people. And each of them were leaders in their fields, really leaders. So finally, the result of what we did during my presidency was a result of collective thought and collective action. And I can say very confidently and very proudly that we changed the world of allergy in a big way for several reasons. One is, for example, I'm not sure if you know the word ICD is International Coding of Diseases. International Coding of Diseases is how you code the different diseases. And that's very important for even keeping a registry, for statistics, for health insurance purposes, for calculating, for analyzing the mortality rate. So for many reasons, ICD is very important. Allergy was never coded. So during my presidency, we initiated a task force, which comprised of other people who did the groundwork. So it was not me doing everything. They did the groundwork, and they worked closely with the World Health Organization when ICD-11 was open for a public comment. And they worked internally with this thing. And I worked personally with Margaret Chan. As you can see here, this is Margaret Chan. And I had several meetings with her to try to push this agenda forward. And finally, allergy is now in chapter 4 of ICD-11, which will be implemented next year. And it was approved in 2019 at the World Health Assembly. So that has made a complete change in this area of allergy. And I think that was one of the greatest things that we could achieve during that time. Amongst the other things that we did achieve, like we started training schools, we did many, many things, junior member, many other initiatives and guidelines. And this is me again at the United Nations, where we were actually invited to speak at a pre-panel of the UN's Congress on Biodiversity in Rio, where we talked about how important allergic diseases should be considered in relation to environment. So we had people who were urban planners, people who were architects, people who were parliamentarians, all about 6 or 7 of us were together in this panel. And then even the concept that all these things need to be taken into consideration while building cities, while planning cities. So this was a very important move that happened during that time. And we tried to get allergy included in the NCDs. And here again is like the presidents of 4 organizations, me on the extreme right, where we came together to give a global call. We call it, I call a global scientific voice in allergy and immunology as a collective voice, again, to make for the same reason. Now, this, of course, was the recognition that was given to me, the WOW Gold Medal for my work. But again, I say this is not just me. I got it, but it's actually the result of the work of a lot of people. So this belongs to a lot more people than me. So a lot of people, everybody who worked hard to deliver the things are actually equal recipients of this recognition. And then I'd like to just highlight a little bit about women in medicine and science. And this was a recent editorial that we were invited to write. And this is Mariana Castells. You can see here from Harvard. She heads the Department of Drug and Hypersensitivity. Carrie Nadeau. She heads the division for pediatric allergy and immunology, and also for she does much work on personalized medicine and food allergies. Mubachal Actis, she's heading the immunology allergy division and does a lot on B-cell tolerance, which is also B-cell regulation, which is also important now in this COVID times. And this is myself, and this is a very young upcoming lady who is the future. So the whole idea is very important, because science and medicine does not have gender, does not have geographical borders. It does not have any boundaries. It is open to all. So we as seniors are responsible to create the future, to nurture them, to give them the platform, to help them, to facilitate them, to make the world full of really smart and capable people. Because if we don't do that and everything ends with whatever we do, then there is no future. And this is very important. And as we do, we should multiply. And then just a few words about my organization, the many initiatives that we have started as a result of my presidential initiative, including the different adding on a conference to the Congress, many e-learning platforms, many committees. We have 24 scientific committees that are working on many aspects, and we have publications from each of those committees. We have educational partnerships across specialties with different, including nutritionists and endocrinologists and gastroenterologists. And so the whole idea is to the creation of inspirational interviews. We also interview people who have made a big difference, so motivational conversations. We have Science to Action, where we are interviewing Nobel laureates and seeing how they today translate their scientific discoveries into practical aspects for the public. For example, we recently interviewed Peter Doherty, a Nobel laureate in 1996, because he's now writing books and he's a communicator to the public. And his work was on how the immune cells react to viruses. And there couldn't be a better time than now for him to be a communicator and a public listening. So we are doing that. We have created guidelines on the vaccine, safe implementation of the vaccine, because there is so much of vaccine hesitancy. People are nervous because it's the first time that the vaccine is being developed at the same time that the pandemic is there. And people are scared of anaphylaxis. People are scared of allergic reactions. People are scared of other side effects. So to give people the right knowledge, both clinicians as well as the public, is a part of what we are doing. And then, of course, creating the junior members forum. And there are a whole lot. I don't want to go into all of this, but this is like what we are doing: white papers, guidelines, manifestos, research collaborations, centers of excellence, master classes, and a variety of things. But all these are new initiatives that we are doing. And again, it's a team of people. It's not just me alone. So the credit never goes to me. If something goes wrong, I raise my hand and say that's my responsibility. But when everything goes well, it's always a shared credit. And in the end, I'd just like to say that Asia is actually forming half the world. Allergic diseases are a major health problem. We need to increase the level of knowledge as well as increase the number of people who are able to treat. There is lack of uniformity in the healthcare services as well as in the specialty, and there's socioeconomic challenges in our specialty. So in our field, we are now really focused on trying to reduce the disparity and trying to increase the knowledge basis as well as the human resources in it. And with this, I'd like to say thank you very much for this opportunity to speak. And I'm happy to answer any questions, including any questions that are related to the allergic reactions or side effects or the safe implementation of the vaccines or anything related to allergic diseases, anything at all. So thank you very much.
Thank you, ma'am. Thank you very much. And
yes, and the last slide, I forgot. This is a pride because he's an Army officer. We just have the first gold medal. He brought us pride. He brought us pride as the first gold medalist. Just spoke to him a while back, congratulating him. Actually, he's just very close to my home, but we are not allowed to really meet because of the COVID restrictions. But here is the young army officer who has brought honor to India.
Thank you very much, ma'am. Thank you. If you can stop the slideshow, then we will have the full screen with everybody on.
Yeah, I'll stop share. Yeah.
Yes. Thank you very much, ma'am. That was a very interesting talk. You took us to a very interesting journey of your life. And you also mentioned about the importance of inculcating family values. I think you have been a great achiever in all the endeavors that you have undertaken till now. So we start the question and answer session first. And the first question that I want to ask you is that when you talked about your journey of your life from your school to college, and your aspiration was to be a doctor, and then your parents told you that it was a tough life and that they wanted you to become a diplomat and things like that. Now, thinking back, as a doctor, has your journey been really tough?
Well, it's very interesting. And because my father passed away, so he has not seen me in the current state, but he did see me to be happy enough that I was successful. But when I think back, my dad wanted me to be a diplomat, not my mother. My mother was always supportive of whatever, because she had full confidence that I could do what I decided to do. But my dad was more apprehensive. I think I made the best decision, because for me, even today, over and above any position, over and above anything at all, the most important thing is a patient. I will leave everything aside to help a patient, because that's where my vocation is, to help patients, is to help people get well. That's why I became a doctor. And I am very happy. But I'm also happy that I fulfill my father's dream also, because in leadership, there is diplomacy. You have to interact, especially in my position, I'm interacting with, we have 108 member countries in WOW, in the World Allergy Organization. And in APAAACI, we have 16 member countries. But of course, we interact globally. So we interact with so many organizations. So there you need to have diplomacy, you need to learn marketing, you need to, interaction, so many skills that come along outside of what you learn in medicine. So I think I fulfill my father's dream also, along with my own. Yeah, and the part of you asking me, sorry, I missed that, about it being tough. Well, yeah. I think my dad was more worried about me, because you know how parents are towards their children, they're very protective. But I know one thing about myself, that for me, it's not the successes that drive me, it's the obstacles and the challenges that always drive me to move further. So difficulties are always my biggest pusher.
Oh, great. In fact, I just see a comment on the chat box from Commander Ravi Shankar. He says, we are sure you could have equally done well as a diplomat. And I think that's a very good statement from Commander Ravi Shankar.
Thank you.
Okay, ma'am. I have a couple of questions before I move on to the questions from our viewers and what we have in the chat box. Now, this is coming more to a professional question. How do food allergies rank in importance as a cause of global allergic disease?
Well, when you look at the percentage of people suffering from allergies, asthma and allergic rhinitis still are high. We have much more people who have asthma and allergic rhinitis compared to food allergies. Because food allergies, of course, is more common among children, but then, of course, also it occurs in adults. I myself am severely allergic to crustaceans. So food allergy is much less in number, but it's increasing. The number of cases of food allergies are increasing over time, and it's becoming challenging because food allergies can be very fatal. One can have severe reaction like anaphylaxis, And if it's not identified, you may be exposed to it again and have the same reaction and can lead to death also. So understanding food allergies, diagnosing food allergies, giving a good management plan, having EpiPen as a auto injector, which is not available in India, and I've been trying to push for that also with the DCGI. So all these things are absolutely essential, because no one should die of food allergies. Because what is food allergy? You're just reacting abnormally to a substance that everybody eats. So it's not fair. If a child dies of milk allergy or dies of peanut allergy, it's not fair. It's an unwanted and unacceptable death. So the proper diagnosis and the proper management and the proper way of guiding patients with food allergies and preventing that from happening is very, very crucial.
Right, ma'am. There's a question from Group Captain Mohan Das in our chat box, so I would just go on to that now. And what he basically wants to know, again, something which is related to the food allergy. He says, I would like to know why peanut allergy is widespread in the US. All schools have tables earmarked for those children. What has been done in this field to overcome this issue, the peanut allergy?
Very important question. Now, peanut allergy is much more common in the US than in the rest of the world. Well, it's now quite common in Australia, and it's increasing in incidence in Japan and Singapore and some of the countries as we are becoming more urbanized. But it's not common in India. It's not common in Israel. Like if you look at Israel and UK, you'll find that the same ethnicity, the children in Israel don't have the peanut allergy, but those in UK have. So the understanding that we have as of now, which is not completely well defined, is two things. One is the fact that it's processed, the roasted peanuts, the way the peanuts are being processed and being taken is one of the factors that's causing that kind of sensitization for them to develop peanut allergy. The other thing is the time of introduction. So now the recommendation is to try to introduce allergenic foods early in life, because many people try to delay the introduction. And the science now tells us that delaying the introduction is more likely for a child to develop allergies. But beyond that, I'm saying this is something that we are working on, is the microbiome, the gut microbiome. So those are things that we still are trying to understand. So the maternal diet, the child's diet, the use of antibiotics, all these different things influence actually the development of allergies, not just peanut allergies, but allergies as such. But that's still being studied. We're also studying the different groups all over the world studying that, and we will have an answer to it. Now, for what is being done of peanut allergy, I can tell you that in US now, they have a kind of immunotherapy where you can give, you desensitize by giving the peanut. That's still, again, just started in the US, but it's not widely done in the rest of the world. Clinical studies need to be done elsewhere for it to be done. And there's also peanut patches being studied where a patch is applied on the skin, and again, because skin also is a source of absorption of the allergen.
Okay, ma'am. Now, so would you say that are there any, influential factors which, result in the development of food allergy?
Can you repeat the question?
Are there influential factors for the development of food allergy?
Well, that's what I said. Like food allergy is not isolatedly a thing. A person who can get allergies can get allergy to food, or to or can get asthma, or can get rhinitis. So it's basically you can become allergic. The three important factors are like your own immune system, the environment you live in, and of course the allergen itself, in the presence of the allergen. So with increased environmental pollution, with increased reduced biodiversity, with the immune system, like I said, that the early first 100 days of a child's life is very important as the gut microbiome develops. All these different factors play a role in skewing the person to becoming allergic. And when you become allergic, you can develop asthma and rhinitis, or you may just have eczema and food allergies, or you may just have asthma. So that is again, there are different patterns in which they appear, or you may have all 2 or 3. And very often egg and milk allergy, children outgrow it by 8 or 9 years. So in the past, the advice was, okay, don't give them that if they are, sensitized to it. Now that's not a thing. Now what we advise is, if they have it, we do food challenges and we try to find out till what extent can the child tolerate. And then we give gradually at home, gradually increasing doses of it, amounts of it, and they develop tolerance over time.
Right. There are some more questions in the chat box, but I think I'll go back first to our audience now. Brigadier Shanmuganathan has raised his hand. Brigadier Shanmuganathan, can you kindly unmute yourself and ask the question, please? And Prabila ma'am, next question will be from you.
Good evening, good afternoon, ma'am. I am from U batch. I am of FMC. I am the professor of medicine and rheumatology in a medical college. Excellent talk, ma'am. What my questions are two. One is a little scientific, and one is more of social question. The social question first, ma'am. The mothers vaccinate the children without any ado. They vaccinate 10 or 12 diseases, but there is a tremendous vaccine hesitancy among the lower socioeconomic status in Tamil Nadu. In fact, Tamil Nadu, though it's well educated, even at the rural population level, vaccine hesitancy is very, very high. They're just not, most of the maids are still not vaccinated. That is number one. What could be the reason in spite of so much of literacy? It's an inverse relationship. Certain not so literate states have got high vaccine penetration. And number two is, intuitively, I think mRNA vaccine have a propensity to become an oncogene, means because it may reverse transcript and incorporate in the genome. So I thought time-tested adenovirus vaccine like our Covishield, Covaxin, and Sinopharm and Sputnik should do better. What's your comment, ma'am?
Well, if you're talking about vaccine hesitancy, let me say it's not just in Tamil Nadu. There are big groups in the US and Australia, and people are struggling with it. And in many countries, they are actually propagating that, you should not get vaccinated. It's easy. It's better to have herd immunity by getting infected. And that's exactly what is wrong, because the only exit, this is a pandemic. We are not like, it's not like being in an influenza situation, or that you have a milder form of disease or something. It's a pandemic, and it's not even like SARS-CoV-1 that happened and was limited to just a few countries. So the important thing is to make them understand that the vaccines are safe. The incidence of adverse reactions are very low. Even anaphylaxis. The anaphylaxis is not to the vaccine as such, it is to the excipient. They might be reacting to, and in case of people who are anaphylactic to other things, there are precautions taken, like, for example, monitoring for the 30 minutes or so. If somebody develops a reaction to the first mRNA vaccine, then they are not given the second shot. And now, of course, a mixing of the two different vaccines are being done, are being studied, and will be implemented. Now, about mRNA vaccine and oncogene, I don't think there's any evidence as such at this moment. So I would not like to comment on that. As far as we know, they are safe, and mRNA technology is 20 years old. It's not something new. It was never used in vaccinology, so I do agree. But as of now, there is no evidence supportive of that. For the adenovirus vaccine, of course, that's the traditional ones that are used. And again, that also had some, the AstraZeneca, which is now Covishield in India, also had some cases of anaphylaxis. But again, that is also due to the polysorbate in it. And those can be averted by, if needed, doing skin testing with graded doses of the vaccine, or with, certain laxatives that have a similar composition. So, so I think it's very important to convince the people that the only way to get out of this pandemic is to let as many people get vaccinated. because the more they get vaccinated, what happens is, even for example, there is a second wave or a third wave or a fourth wave, the severity of disease is much less. So if you look at US now, the number of people who are getting admitted in hospitals, even though there is a surge, they're mainly people who are unvaccinated. 99% are unvaccinated people. The vaccinated people do not have severe disease and is not associated with mortality. So this is very crucial to make people understand that. And well, again, in India, the challenge is, again, you have different levels of education. So sometimes it's very difficult to convince people who may not understand that. But I think it's the best you can do is to try to make them understand in the easiest possible language that the only way that you can save yourself and save your family and the people around you is by getting vaccinated. And I will speak like a broken record, like Maria from the WHO also says, that vaccination is the only way out as of now.
Thank you, ma'am. Thanks a lot, ma'am.
Thank you, ma'am. Thank you. Next question for you is from Mrs. Pramila Rajan. Ma'am, kindly ask your question.
Good afternoon, doctor. It was wonderful, very informative. I have 3 tiny questions. One, and they all pertain to the COVID vaccines that we have all been vaccinated with. Now, we find that there are stories about reactions of myocarditis when a Pfizer vaccine was given. And the second one with the blood clots being formed for the AstraZeneca. Now, would you say that these are rare occurrences due to compromised situations in the body, or is it a normal reaction to expect from any of these vaccines?
No, first of all, I say it's not a normal reaction. Definitely not a normal reaction. Normal reaction is like fever and like, maybe you have joint pains, you might have sore throat, you might have body ache, you might have, malaise, all those things are swelling, and like with Moderna especially, and even in some cases you have like a very swollen red arm, it becomes red and swollen. All those kind of things are more reactogenic, and that's actually a good thing. Now, these other reactions are very rare. Now, we don't know the back history. For example, sometimes is this, and because the way things are reported, whether the person already has an immunocompromised situation where there is some baseline cardiac, that is hypertension that was not known earlier, these kind of things could be there, and they're being analyzed. So it's not, and it's very rare. And about this blood clots, yes, that's again has been looked at. And again, that's, it's due to certain mechanisms, which it takes a while for me to explain that, but basically due to certain autoantibodies that occur, and that again is very rare. It's very rare. But now what has happened is, because it is seen more in women less than 40 years of age, basically who are generally in the reproductive age. So in many countries, including in Japan and Australia, it's not being given in women less than 40 years. So it is given for women above 40 years and so on. So, yeah. So I think that's the current CDC or recommendations, which we also follow, because we created our guidance based on what the CDC or the FDA and the EMA actually make recommendations on.
The second question, ma'am, is that how long does the serological load remain in the blood before we are asked to take the second shot, a second set of jabs?
Well, basically with the first dose itself, of course, it varies with the vaccine, the antibody responses, and also can vary with people individually also. But generally, for the Pfizer, that's what is being given, Pfizer and Moderna, we give it once in 4 weeks is what is being given here. For Pfizer, yeah. For Covishield or the AstraZeneca one, their initial recommendation was for 4 weeks, but they realized that the serological to test that they are there longer. So it was wiser to inoculate more people and then go on to the second dose, because you get a good amount of antibodies with the first dose itself. And then you get the second dose. And in fact, now people are talking of a third booster also, but still we don't know whether that's really needed, or whether we can have it or not, because there's a lot of vaccine inequity that's happening around the world. Especially with the COVID situation in India, many of the countries that was depending on India for the vaccine are now not getting it. So they're taking it from China, the Sinopharm and Sinovac, Sputnik. So, so this is actually a very difficult situation. And the World Health Organization, as you might have heard from Dr. Soumya, who's my classmate, who spoke to you last time, that, there's the COVAX that's also trying to provide that greater distribution around the world. But again, there is a limit to how much vaccine is. We need to produce much more vaccine to reach out to the whole population. There are countries like in Africa, maybe it's so poor, poor state of affairs that there's a total lack of sufficient vaccination. Whereas in US, 50% of the population is already vaccinated. UK, a large percent is vaccinated. Japan had started very late, but we have 25% that is fully vaccinated and 35% that has got one dose, but still far from getting over 85%. And I think if you can get over 85% vaccination, then the chances of herd immunity is higher.
Now, how long does the serological load stay?
That is very, well, that's like a guess kind of thing. People are guessing that it's 6 months. Some are saying it's 8 months. Some are saying it's 10 months. It's very difficult. But I just wanted to also say there's not just an antibody response. There's also something called a T cell memory and a B cell memory. So, those things also come into play. So somebody may not have antibodies and say, oh, no, I didn't have any this thing, but they might have T cell memory and B cell memory and then not have a bad infection. Even if they get infected, they will not have a bad infection. So those are also things that one has to understand.
Thank you, ma'am. My last question is, why do some allergies develop later in life? A child brought up on milk and cheese and butter and all milk dairy products at the age of 14 or 15 suddenly develops lactose intolerance.
Well, today I will not discuss about lactose intolerance because that's another huge topic in itself. Lactose intolerance, do not mistake it for an allergy. Lactose intolerance is totally different from allergy. So we cannot say that a child who didn't have allergies developed lactose intolerance. If the child had developed milk allergy, it's different. So lactose intolerance is totally a different subject. And if I start talking about it, that's another topic in itself. Yeah. So that's basically you don't have the enzyme to digest the lactose, and that's the thing that happens in that. But having asked this question, for other allergies, yes. For example, I used to eat crustaceans. I used to eat shrimps when I was in medical school, but all of a sudden in my third year of medical school, I had a severe allergic reaction and anaphylactic to shrimps. And I cannot have, I'm very allergic. So you can develop allergies later on in life, but not so common with milk and egg. That's more in children. Whereas other allergies like lentils in India, chickpeas, lentils, people develop this later in life. To brinjal, with these kind of things also you can develop later in life.
Thank you, ma'am. Thank you very much.
Dr. Ruby, next set of questions for you is from Dr. Mrs. Shobha Vartaman. Ma'am, kindly ask your questions.
Good afternoon, Professor Ruby, and thank you so much for giving us this privilege of listening to you. It's really an honor, actually. I have two small questions. And one of my question is that, we say that my daughter is also an immunologist, and she tells me that atherosclerosis is due to inflammatory causes and also cancer, which all of these come into your basket of immunology. And when you break down the immunological responses, they inflammatory or otherwise, they also belong to the allergy part of it. So now anything like heart attacks and cancer, everything is immunological now, basically. And with this, the thing is the instrumental cause of these childhood allergies like asthma and everything being environmental. And that's the basic thing. Now, India. and government and doctors can do only this much. And you know the scenario here, low illiteracy, superstition, beliefs, religion kicking in, and things like that. Have you got any public health projects which are specially designed for India to create awareness, to make these people realize that they can change their environment or lifestyle to save themselves from allergy? Because now it is self-help is the best help. You can cry for till kingdom comes saying that government should do this, doctors should do this, but it's not going to give a lot of results actually. The second question is,
Can I take the first question first?
yes.
Okay, so before I forget, because it has several elements, it's a very important question, and you have actually touched something that's very core to my heart at the moment. I'll tell you why. Number one is, you're absolutely right. Although I don't deal with atherosclerosis, I don't deal with cardiovascular diseases, I don't deal with cancer, because allergy and immunology is allergy itself is immunological, but it's part of but immunological diseases have many more, including IBD, including Crohn's disease, including diabetes, all these heart attack, hypertension, all these are also immunological, because immunological changes forms the core of HIV, so immunological diseases, whether it's infective or non-infective, TB, infective or non-infective. So you have non-communicable diseases, which are non-infective, and then you have communicable diseases. But in all these, immunology plays a crucial role. But I'm basically specialized in the allergy part of it. But having said that, what you said is very important, is that all these non-communicable diseases, whether it's hypertension or it's diabetes or it's atherosclerosis, what we understand now is many of these things can actually be programmed early in life in a child. And the reason, and that they are so related to lifestyle. And I give you one example, is my own example. And as you can see in the pictures that I showed you, I was twice my weight now. From what I was around 42, 43 kilograms, I went up to 81 kilograms. But even though I had crossed the age of 50, I changed everything. I changed everything just because of caring for fitness and changing my lifestyle. I did nothing artificial, no artificial intervention, just a very balanced and appropriate diet, very strict about it, and gradually increasing my exercise levels and activity and sleep, because I never used to sleep. Just being busy, I would sleep 1 hour every day, and that was like causing a lot of problems for me. So I think that kind of change of lifestyle, I could change everything from backache to knee ache to hypertension. I don't take it. Everything is completely gone with just a change of lifestyle. So if I could do this after the age of 50, this is something we should try to inculcate in children, that medicine is not about just treatment. Medicine is also about prevention. How can you prevent these diseases from happening? So how do we educate the people to have the right kind of foods, the right balance of food, the right nutrition, the right lifestyle, not to be just sedentary children. I mean, now the COVID situation is different, but otherwise, not to be sedentary, not to be on the iPad always, but playing, moving, all these different elements come into play. So having a very balanced lifestyle is very important. And then avoiding things like a lot of things like preservatives are also can be a factor. Excessive use of antibiotics can be a factor. Several such factors, because it's not that the genes mutate. Genes don't mutate in 10 years or 15 years. It is what we call as epigenetics. Epigenetics means the interplay or interaction between the environment and the immune system. So what happens is, when the environment and the immune system interact because of certain changes in the environment, then it causes changes in the function of the gene. So the gene doesn't they mutate, but the gene's function is altered, and then that leads to disease. So that's one thing. And the other thing is, of course, the change in lifestyle. So having a good lifestyle, good nutrition, good sleep, good activity, good diet, these are absolutely key factors right from early life. And I think if we have some over time, we will be able to get answers to our studies on birth cohorts. And we may be able to see if things like probiotics or prebiotics or symbiotics or vitamin D, all these factors, whether they have a role to play in preventing the development of these chronic diseases. And the other thing is reduced biodiversity, which is also known. Like with the change in the environment, there are less plants, the foliage has changed, the birds have migrated, all these different things. This we call as water VPSI or water bird population index. That when that goes down, there's an increase in all these immunological diseases. So again, that reduced, we have published papers on that also, and there are others also published. So that again is showing very clearly that reduced biodiversity is also important. Then pollution, air pollution, yes, but also pollution that occurs from pesticides, what we ingest. So there's so many different factors that interplay. And to your question, whether we can do something for public health, I would love to. We have not created something, but if there's something we can do together with you and your organization, I would be very, very happy to do so, because I think those are very meaningful things, because we are very patient-centered. One of the things that I've been very much pushing with EMA, the European Medical Association, and is actually even in guidelines, we should have patient-reported outcomes. We should have the patient's voice. I think it should not be the top-down thing only from the doctor to the patient. We need to listen to what the patient has to say and how the patient is responding, because the patient is not in a randomized controlled trial. The real world studies are not always reflecting the RCT. So we have to have RCT as the base, but we must also take into consideration the real world data and then mix and match both to see what is the best outcome. Yeah, your second question?
No, it's a very simple, ignorant question, actually. When somebody has a child with childhood asthma, is it likely that that child can also get food allergy and are they all interrelated? And
Yes.
how does the parent, identify or prevent or help? Because this will be a very basic question for us.
That's a very important question, because there's something what we call as the atopic march. So usually what's most common in children and infants, you get a kind of eczema, the skin, eczema. From eczema, food allergy, and then asthma, rhinitis, that's the kind but nowadays what we see in real life, we find that very often children have asthma. Actually, generally you can't detect asthma, in a proper way less than 5 years of age, rhinitis, but it's usually viral induced in those very small children. But them having asthma and them having food allergies is very common. And skin allergy and food allergy is also very, very common, because we know now that allergens can also get absorbed through the skin because of a disrupted barrier. So in food allergies, one of the things that we do is if the child has eczema, you need to control the skin properly, keep the skin absolutely treated for the eczema, and then control the food allergies. But food allergies and asthma and allergic rhinitis, all these conditions, even if they don't go away now, as of now, they don't disappear, they're not completely curable, they can be all well controlled with the right guidance and with the right compliance. So the doctors have to give the right. Now for food allergy, you can detect by skin testing, by serological testing. If the patient has symptoms, you have to do this thing, and then the food challenge is the final golden, the gold standard for it. So the right guidance and right treatment can actually prevent a child from having an acute episode of a reaction. And of course, generally you carry EpiPen. In India, it's not available, so you can do a name patient basis and get it from abroad. But I'm really hoping that I'm pushing for it to be made available in India because it's a life-saving drug. In fact, that was one of my missions with Margaret Chan, which never really happened. I was telling her that the EpiPen should be like an AED because it saves lives. And for example, in Hamilton, in Canada, every restaurant should have an EpiPen, should have at least one of the staff should know how to administer. In the US, all schools, the staff should know how to administer EpiPen. So this is absolutely very important, especially with India having such a huge population.
Thankfully, food allergy is very less in India, so that's fine.
Well, I guess so, maybe less, but also maybe going undetected also.
Undetected. See, the other thing we've noticed is that when the child is, it addresses stress, it manifests as childhood asthma. It usually happens when the second child comes into the family. And it accepts in the first 6 months, but then the child develops asthma after 6-7 months and of seeing the second baby getting more attention and things like that. Do you think that's a common cause?
I don't think so. I don't think that's really a reason. I had childhood asthma. I was the second child and my brother was absolutely fine. It was I who got asthma. So I don't think that kind of stress from work-related stress and all can aggravate it. Stress is not a cause for asthma. It does not induce. There has to be an immune reaction actually to cause the asthma. And the stress is like an aggravating factor.
Thank you very much. My son, me, so thank you.
Okay.
Arsha, you have a few questions on the chat box.
Mani Gopal also had a very interesting question.
Okay, can I go to the next question? We have a couple of questions in the chat box still left with us. The question from Wing Commander Muthuswamy. White patches in the skin, is it an allergy? I think he is referring to leukoderma.
Well, no. And I would not see the patient. I would refer to a dermatology department.
Okay. Okay, ma'am. Then there's a question from Wing Commander Ravi Mani, who says, with the contamination increasing the food chain, do we expect allergic manifestation to increase manifold? And that, if that is the future, immune system responses and allergies could become unmanageable.
Well, most of the allergic reactions occur to the food itself, So one of the challenges I would say, but I think it's also improved in India because food labeling is very important. And food labeling is not compulsory in many countries, which is why it's risky, like Japan and US and Singapore and Australia, Korea, Thailand, very, very strict food labeling. Even if you have very minimal amount of a particular allergenic food, you have to. There are 9 absolute essential ones, and there are another 14 which are optional ones that have to be declared if it's present in a particular food. But you're talking about things like additives and things like that. Yes, I mean, these kind of things can cause, but they're not the primary cause of this thing. The additives can cause some reaction. People do have, and those can be tested, and one can identify if one is allergic to that. But the main thing is the particular food substance itself. But what is important is actually the food labeling is very, very important.
Okay, ma'am.
Dr. Rukmani Gopal has put a question.
I'm coming to that. The question for you from Dr. Rukmani Gopal is that Indian medicine like Ayurveda has a role to play in immunology. What are your thoughts on this, ma'am?
First of all, I would just say that I am so ignorant about it that I would not consider myself qualified to answer that question. And, the two things, one is we need evidence-based data to show that something is proven and effective. But again, if something is not there, doesn't mean that it doesn't work. So I think the best way to know the answer is the people who are actually working in that field should do studies to show that it is effective. And, because if you have like 1 or 2 incidences where it's effective, that doesn't prove anything. So a proper studies, if done, I would encourage actually doing those kind of studies to prove that it is effective. I remember almost 10 years back, we published a paper with the World Health Organization. It was on alternative medicine, not just Ayurveda, but also including the Chinese Campo for asthma and allergic rhinitis. And we came out with a conclusion that they were not effective for, so complementary medicine as such, and alternative medicine was not effective for asthma and allergic rhinitis. But, that is almost 10 years back. I don't know if there are studies being done. And if studies are being done, I'd be happy to receive some of the papers. My email is known to Wing Commander Ravi Shankar and I think some of you. So, anybody can reach out to me with such information. I'd be happy to look at it. But I'm not qualified to say, make a recommendation on it.
Okay, ma'am. Okay. There's a question from Mutturaja Singaraja. He says, where do we stand in the field of allergy and immunology? Where does India stand?
Are you talking about the cases or talking about the specialty? The question goes back to him because the answer
Yeah,
could
but
be
that's,
entirely.
well, I think you can answer both very shortly, ma'am.
Okay, well, for the patients, allergic disease are increasing in India. So like every other country, allergies are increasing globally. So it's a global trend. It's not just limited to the developed countries. But for the specialty, I would say, unlike cardiology and other different branches which are very, very well developed in India, allergy, and the reason is that allergy is so multi-organ. So some is the skin, some is related to the upper airway, some is related to the lung, some is related to the drugs, some is related to food allergies. So pediatric gastroenterologists may be looking at the food allergies. Allergy is a specialty. There are a lot of people who are now studying allergy and interested in allergy, but we don't have allergy as a established specialty in India. That was something that I was very keen on and trying to drive, but of course, it's something that requires much more effort from the side of the government, and I hope that really happens. We're also trying to do it as the APAAACI, as the Asia Pacific organization. We are trying to provide a platform to give specialization to people. So if they are more specialists, actually very, very well-trained specialists, I think then for our population we would have. Right now, we have very few people who are trained. So I would say the patient to doctor ratio is very low.
Okay, ma'am. I think we're done with the questions in the chat box. One final question from my side. And that is...
Krishna wants to ask.
Oh, Krishna, you have a question?
A small question. Although you partially answered, ma'am, how effective is homeopathy for allergic asthma? You've already partially answered that you won't like to get into a controversy. And the joke is...
It's not about controversy. It's just about the fact that I am not knowledgeable enough to make a recommendation on yes or no. But, well, homeopathy has proven to be effective in certain things, but we don't have, like I said, we have looked at all the data that's available, and there's no data showing that homeopathy is effective for asthma or allergic rhinitis. But on an individual basis, maybe somebody might respond to it. But again, that's more like individual. And I think if good studies are done, and if studies can show it, I would be the first one to support it.
Well, do you grow out of your allergy also after some time?
Well, childhood asthma, people do grow out of, like I did. I had childhood asthma, I grew out of it. Milk and egg allergy, generally around 8 or 9 years, children grow out of it. But other allergies like crustaceans and things like I have, that you don't grow out of. And adult onset asthma also one generally doesn't grow out of.
The joke is that allopathy is for the sick and homeopathy is for the healthy.
Well, I would go one step further. I hope allopathy or the medicine that we practice today becomes more public health oriented and preventative. If we have enough science to move in that direction, if we have more dedication to work towards public health equity, to also make prevention as our this thing. I don't mind not having a job. That's fine. If I can make the whole world well, I'm very happy.
Thank you. That's
As a practicing homeopath, I would like to add here, yes, to answer Colonel Krishnaswamy, there are instances where asthma and skin allergies, eczema, these are interrelated. And you suppress one, the other one flares up. But over a period of time, so 6 to 8 months, we can revert the situation and the patient does become free. It is proved. And I do practice homeopathy. And I beg your pardon, ma'am, for having poached in onto your field.
No.
It's a fact.
No, ma'am, I would encourage, I like I said, I'm ignorant about it, so I cannot say yes or no, but all I'm saying is that I encourage such kind of data. If you can accumulate good number of patients and actually publish it, those kind of things will prove the basis for future recommendations. I think that's very crucial.
I haven't done that, but yes, over a period of time, nearly 10 to 12 years since I started in 2000. Oh, it's more, 20 years almost. And it has been effective in a number of cases. So I feel happy about it. That's about it.
Okay.
I've already started a controversy.
No controversy. Just saying, my part is this. Hers is
I plead guilty.
You're always an Narad Muni in any case.
Okay, ma'am. One last question from my side before I hand over to Air Marshal Vartaman. And this moving on to a personal question, what is the biggest factor that has helped you to be successful in your career?
Well, to answer that question is, I would say, how do we define success, right? And for me, success is not positions. As I said many times before in my presentation, that leadership is not about power and success is not about position. Success is not about the awards you get. Maybe I got the President's Award, maybe I got the WOW Gold Medal. Those are things that, okay, you feel happy that somebody's recognized you for something. You're happy for a day and that's it. And I just forget about it. It's over. What defines success for me is, how could I have changed the lives of people? How could I have changed the lives of patients? How can I change the future of the younger generation? How can I build a future? When I'm in an organization, how can I develop the organization so it becomes dynamic enough to grow and to flourish and actually serve the community? So service to community, service to the patient, service to build the future generation is my and to science, and to create new science which will lead to therapies. That is my parameter for success. So, and what drives me is anything that tries to push me against it, I find another way, as long as I believe that I'm doing the right thing. But these recognitions are just like, in the box.
Well, ma'am, thank you very much. It's been a very interesting morning listening to you. You've been speaking to us for close to an hour and 10 minutes. And we sincerely thank you for all the time that you have spent with us. And we're really delighted that you chose to speak to us this morning. Now it's back to Air Marshal Vartaman, sir, for his final comments and winding up. Sir, back.
Yeah, thank you. Ma'am, before we wind up, my question is, the Delta COVID the final one, or there is an Echo and Foxtrot?
Well, people are talking about a Delta Plus that has also been found in Korea. I don't know the situation in India. I heard that a Delta Plus was coming in In Korea, at least, they found a Delta plus. In Latin America, there is a Lambda also. So, I mean, viruses mutating is not an abnormal thing. Viruses are, bacteria don't mutate, but viruses mutate like anything. What's important is if we get a mutant that is weaker in strength and does not have the power to transmit as much, then it's much better. But if we get a mutant that is much more transmissible, then it's a challenge. But even having said that, I think all the companies that are developing these vaccines are looking at the effect of the current vaccines on the new variants. But even if something doesn't have a 95% efficacy to the new variant, it'll have, say, probably at least 65 and above. So I think what we really need to do is to get everybody vaccinated as much as possible.
Not accept.
Ma'am, one more question. We are military guys and veterans. So we are always strategizing and we are, assessing the enemy. It is a little controversial. You need not answer. Is this lab created?
Well, there is no evidence to that, honestly speaking. And, there's always gossip surrounding things. I mean, people work with viruses everywhere. It's not only in Wuhan that they're working with viruses. Everywhere there are, and the way when people work with viruses, I mean, the control conditions are so strict that the chances of something leaking is very, very low normally. Okay. Now, having said that, we don't know if something did this, but at the moment there is no evidence. So I think a lot of energy has been spent on speculation of this, and I think it's time to move forward. It's not the time for humanity to try to. I mean, as much as I would be very upset if it was if it's lab generated, also it's different whether it was intentional or it happened by mistake. If it is intentional, it is bad. If it happened by mistake, it could have happened in any lab, right?
Yes.
Right. And I think this virus, in fact, this pandemic has taught us even more that we need to go beyond everything else, that humanity needs to consider care, compassion, and love. And we have to move forward to get over this particular pandemic together as a human race, not as a Chinese or a Japanese or an Indian or an American, but or an African. We have to all work together to fight the virus. That's our common enemy. And we have to move forward to try to get back to as much a normal life that we can have. That is my answer to it.
Very well said, ma'am. In fact, you've given me a lot of homework, actually. And you've talked so much about leadership and so many things to do. It's a beautiful journey and your vision is amazing. And that got my brain working. And I find that I have to do a lot of homework. I haven't done enough. And we are not done. I have not done enough. So there is miles to go before I sleep. And I hope there are miles to go for you. Because, the way you are talking, you're talking of the world, you're talking of happiness, you're talking of contentment, and you're talking of prevention. See, many doctors think of cure, whereas you are a person, you're a professor who thinks of prevention. And that is, if all of us could work on preventing a problem, I don't think we will need to suffer so much in the world. Ma'am, your vision is fantastic and it's good for humanity. On behalf of all of us here, I wish you the very, very best. Like we said, there are miles to go and we'll be watching you and travel those miles and many more accomplishments in the years to come. God bless, ma'am. Jai Hind.
Thank you, and thank you very much for the opportunity to speak with you all. Thank you very much. Okay.
Thank you, ma'am.
Jai Hind.
Thank you, ma'am. Thank you.
Bye.
Guys, Now you got COVID coming, okay? Echo, Delta Plus, and everything is coming.
Lambda.
Okay, you better make
Lambda, and then further.
you better make sure everybody in your street is vaccinated. That's the only solution.
I don't allow anyone who's not vaccinated to enter my house.
Correct.
First I ask, are you vaccinated? Then you can come in. Let's go.
We need that reader, whether that fellow has got both the jabs. And